All right, Dr. Emer, we are live.
Hey guys, it's Dr. Emer. We're day one post our Gladiator transformation, and actually my patient really wanted a more athletic look. Didn't want as etched, but we still gave him some definition because he naturally has abs underneath. And we lifted his chest. That was a big component for him. Take a look. I'm going to show you guys here his chest. You guys could see, we call this the sad chest, where it's kind of angling downward. There's large gland tissue and there's fat. This happens as people get older. I'm going to show you a video here really quick. Take a look. Where this shows the level of sagging there on his chest and even the lower stomach. If you take a look now in the lower stomach and chest, it's lifted because we did a chest lift, and it's much flatter down here. A lot of this is actually internal swelling that's occurring. You guys could see his back had a lot of fat in his flank area. Now it's completely tight. If you take a look, there's almost no fat in that area now because we really tightened it up, and the looseness is improved because we used our plasma. So if you see, we're doing our aftercare, we're doing our massaging, we're getting in really close. Squeeze your stomach as hard as you can. Flex for me, flex.
Flex the stomach.
There you go. You could see the level of tightening. And then put your hands on your waist and kind of squeeze your chest a little bit. Look at the level of lifting. This is the fat. Go ahead and relax. That's the fat grafting. This will settle down. But we really needed a good amount to be able to get the lift that he had because he really didn't have that athletic contour. We were able really to pull in a lot of fat along the sides, really sculpt the borders and flatten everything. What are they saying?
Let's see. Right now, we just have a lot of people coming in. Hi, guys. We are over here day one.
I want to show you the side view. Take a look at the side view right here. No, you're good. The roundness up top with the flattening at the bottom. Before it was a ski slope. Now we have the roundness athletic chest. And also from the sides. Take a look at the sides here. From the sides there, you guys could see, look, the bulge at the lower part of the stomach and the flanks. But now look, the flanks and the lower stomach are improved.
Amazing.
So Michael, tell them about what we do for aftercare and why it's important.
So what we're doing right now is lymphatic drainage. Very, very important. We want to reduce swelling, reduce inflammation. Also want to get rid of any of the toxins, any of the medications that were done throughout the surgical process, and just really give him an expedited look and overall healing process. And make it much quicker.
This will decrease the scar tissue. This will help his skin heal much more quickly. We'll do it with hyperbaric therapy and IV and get him to recover much more quickly. And it'll just overall allow us to get to that final result more quickly with less complication risk. Everything looks amazing now. Even the bruising is actually quite minimal. I'm super excited to see the end outcome for him. Again, taking a look at him here, this is nothing compared to the level of tightening that we're going to see over the next 6 months. And right now you can't even, exactly, you can't even appreciate it. It's much tighter, it's much flatter, but it's going to be significantly better in the future. I want to show you guys one other thing. I'm going to have you turn really quick. Go ahead and turn. On the back. Now, we didn't do buttock fat grafting, but I want to show you what we did do. We created those dimples. So if you take a look, his sacral dimples are much more defined, and I'm going to show you guys what I mean by that. If you take a look on his back before, look at the back there. A lot of fat in the back. This is actually where we got the majority of the fat, but also no dimples. Now take a look. We got those dimples forming. They're going to come in, giving that Venus dimple, that sexy butt look. And he's going to be completely flat along the sides so that his problem areas of fat will be gone and he can focus on his exercising and his dieting in the gym. All right, let me turn you back. The other thing we have on him that you guys are done noticing is our DermaBeam mask. This is something we have people use to decrease inflammation, both on their body and face. It actually works to decrease systemic inflammation. But if you get lasers or any other treatments, this is a great product you can get at emeragecosmetics.com and use to help you heal more quickly. So this is it. He's going to finish his aftercare. We'll update you in about a week so you can see his final result as he gets towards his healing. And then in the next few months, amazing results. Bye, guys.